Burke runs a tight ship. Said, come in the morning, don't waste any time here, get back to work as soon as you can. So thank you, Burke, for that kind introduction. Very honored to be here. Barry, thanks for having me. When I got the call a few weeks ago from Karen, from Virginia Chamber of Commerce, I was a little puzzled as to how the connection was made. Now I get it. And really a pleasure, sort of listening to all the speakers from this morning, connecting the dots, so to speak, between data and healthcare, technology and innovation. These topics are near and dear to my heart. And I'm glad to see that there's so much interest and sort of engagement on this discussion. So I think Dr. Hazel is absolutely spot on. And I think there's some very basic information that's not available to all of our connected set of stakeholders in the healthcare ecosystem. If only they had all that information, if we were able to connect the dots, connect the data to the right set of consumers and right set of doctors, right set of stakeholders in the rest of the ecosystem, our lives would be collectively a lot better. We all know that for a fact that social determinants are a big influencer of health. We also know that nutrition is a big influencer of health. I was reading a book this morning on my flight over. It's called, rather depressingly titled, How Not to Die. And turns out that everything that I'd been eating for the last 20 years is leading to my death very shortly. If you want to read a depressing book, I'd highly recommend reading it. If you want to continue to eat whatever you're eating, I could definitely not recommend reading that particular book. But it talks about the link between nutrition and health and wellness, and has some very sort of sound and sage advice on how to live better. But in the last 15 times that I've been to my doctor, nutrition has never once come up as a topic of discussion. So there's a lot of things that I'm going to talk about today in the next 15 minutes or so that have to do with technology and innovation and big data and the techniques we're using to bring all of that available, make it available to consumers, make it available to a lot of our enterprise clients. But at the end of the day, the information that needs to get into the hands of our patients, our consumers, our enterprise customers is very simple. So I tend to think of it as, I read somewhere that data is the new oil, and it's the information economy is kind of what is driving our digital currency and so on and so forth. And I think it's also true of healthcare. There's a lot of information in healthcare, and I think it is sort of like the new oil. But I think we tend to forget, how does the oil get refined? What are the refineries? What's the technical machinery that gets the data from where it originates into the hands of the people that need it? And how does that happen? And that seems to be where most of the breakdown seems to happen. So just this morning in Indianapolis, Burke, we had a meeting on, we've had issues with eligibility. Why is it such a simple thing as, what am I eligible for, such a complex process? And we spent hundreds of millions of dollars in every state in order to sort of figure out a very basic question. What benefits am I eligible for? Who pays for it? What's my level of coverage? And how do I get access to it? Why can't we connect these dots more effectively? And why aren't those refineries sort of flowing together in order to make all this happen? And how can we make that happen? So our focus in the work that we're doing at Deloitte has been not as much on the high end of big data and the issues that surround it, but being agnostic about the quality of data and types of data that are out there, and really trying to getting it out more effectively and easily across the entire spectrum of healthcare so that everyone has access to it equally and is able to act on that information in the way that makes sense for the different consumers and the different stakeholders that are in the system. So I think this morning, Dan from IBM mentioned that unstructured data was going at about 60% a year. Somehow, we have the same number. So if Deloitte and IBM arrived at the same number, it must be true, I assure you. But that's one I think, sort of dimension of what we need to consider when we look at the topic of data and healthcare. And the theme that I want you to remember for the next few minutes is the data is important, but also the mechanism for getting the data out to the different consumers and the stakeholders is equally important. So data plus refineries. So if we think of the growth of data, with just the iconery that's out here, the smartphones, and how many of you have Fitbits and other devices that we all wear, there's about a terabyte of data that's just floating up in the cloud that's following you anywhere we go. So there's that. And then when we walk into a typical doctor's office, we take a temperature, get weight, maybe blood pressure, heart rate. There's about 4 or 5 things that they check. But there's literally a terabyte of data that's following us everywhere we go. But how do we download that terabyte of data into a context that's applicable to that consumer, that patient, so that the most relevant and pertinent recommendation could be made by the doctor or the caregiver that's seeing that particular, is overseeing that particular encounter. So number one is, what's happening with the growth of data? We know it's growing exponentially, and it's only going to get worse with everything else that's coming online. The good news is there are algorithms that are being developed, there are mechanisms that are being put in place that's trying to sort of bridge the gap between the expansion of data, the availability of data, and eventually getting into the hands of the people that need it. So the trends that we see happening that are driving that are really the payment innovation. I think aligning payments and incentives to how eventually plans and providers and the rest of the stakeholders in the ecosystem sort of connect the dots and ultimately align on what's the fundamental metric in healthcare, which is how do I keep someone healthy, rather than sort of treating it as treating the 20% of the population that's the sickest. So how do we do that? So the trends at the bottom that I've outlined that include consumerism, the movement to a value-based care, and all of the shifts that are occurring from government around macro and other sort of innovations around payments are going to be the pull that's going to sort of, I would say, light a match in the initiatives that are happening across the different sort of players in the ecosystem. So the technology companies that are in Silicon Valley, they're all innovating around how do we take that data and make it available to consumers. All of the work that Anthem and other health plans are doing around how do we really leverage analytics better to address simple things like preventing diabetes, preventing heart disease, all of the things that are behaviorally oriented diseases that consume such a large percentage of our healthcare dollars. So the good news as well as the bad news is that there's a lot of data, there are lots of initiatives, there's lots of trends that are all sort of working together. And I think if this group of stakeholders here and others in the different states all come together with these things in mind and connect the dots similarly, I think there's hope for us to make significant sort of changes in the years to come. So the one way that I like to think about the data and how it's growing is historically we've queried the data to sort of answer a specific question. Am I eligible for something? Which restaurant would I like to eat tonight? How long is it going to take to get to the airport? When we leave here. So you're asking a question of a corpus of data, and you're getting an answer. But what happens if really there are a set of questions that you never thought to ask, for which there are answers? And in healthcare, it often seems like we fail to ask the right questions, yet the answers are out there. So. One of the data points that I heard recently, which is really fascinating, is that a lot of the effort in cancer research is going towards new therapies and new trials and new drugs and whatnot. But interesting factoid is that there are a number of existing therapies that are not getting to people that access it and actually have a better outcome. So how could we make it so that a clinical trial or an existing therapy that's already out there and working gets sort of matched up to the right patient? So we need to think of, when I think of data, I think there's 2 paradigms that need to be thought of in parallel. One is what are the questions I need to ask, but also consider there are a vast set of questions that never occur to me. If I'm maybe perhaps worried about how long is it going to take to get to the airport, I haven't thought about what the weather is in Indianapolis. Is it going to affect my flight? So if I ask that question, if I'm on my way to the airport, wouldn't it be nice if the answer came back and said, it's going to take you 20 minutes to get to the airport, but also your flight's delayed by 30 minutes because the weather in Indianapolis is cloudy and rainy. But how do we make that connection? I'm not making that connection all the time. And think about all the vast possibilities in healthcare about a simple disease that has vast unknown related set of complications and dependencies that an average physician is never aware of. So if we can make technology better to make those connections and make those things available to our doctors, physicians, and consumers, then we can make all of these technologies, and all of the innovations that we're talking about, make them actually deliver the value that they can actually always promise to be. So I want to introduce you to another concept. So we know that data's out there, it's growing exponentially, terabytes and petabytes and so on and so forth. But what are the refineries that get us there? So we at Deloitte have identified about a dozen or so things that really make the difference in terms of how the data gets turned into insights, and how then the insights get translated into stuff that consumers and stakeholders can engage in. I'm not going to go through all of them, but these are what we've called exponential technologies. Artificial intelligence, robotics, nanotechnologies, sensors, and all of these things. And the reason that they're important is, for example, if I took 26 steps from here towards the door, I'd probably get about 3/4 of the way, to the door. But if I take 26 exponential steps, so if it's 4 times 4 is 16, 16 times 16 32, and so on and so forth, the same 26 steps would circumnavigate the globe several times over. So the technologies that are on the previous page, on this page, are essentially nascent innovations that have been growing exponentially. And they may not be on anyone's radar today, and they may not seem all that relevant. But the reason that we're tracking them is because of their exponential growth. So at the right point in the curve, when we intersect that with the data that's already available, we think that that's going to start to disrupt the curve of healthcare, where the costs are going up and the outcomes aren't really improving, to really disrupt that so that the cost starts to go down, the outcomes start to get better, and really consumers start to get the information in their hands so that they can make more informed choices around their health and well-being. And much of the work that we're doing with Anthem actually has to do with how do we make that happen? With the billions of claims and the mountains of information that's available from all of the social determinant factors, how do we intersect all of that to really make a difference on costs and quality and outcomes and all these key issues that are out there? So just a few examples of how this is manifesting itself across the value chain. So in terms of the future of care, the future of surgery, the operations of healthcare, research, in every single sort of business process and a value chain of a particular interaction in healthcare, if you intersect data and you add exponential technologies, you can really start to see a difference. And we're already seeing it. So in the case of the care itself, care delivery itself, there's a company out there called Retina Selfie. So it's exactly what it sounds like. You point a phone back of your eye and you take a picture, and it starts to tell you whether you are at risk for a number of diseases like multiple sclerosis. So again, the data there is the image. Back to Dan's point from earlier. Data, the unstructured data like voice and imaging, is starting to grow much more rapidly than just regular structured data such as text information and so on. So now that our computing capacity is increasing at a pace where we can take an image, process it, sort of analyze it in context of all of the other things that are happening, then the possibilities of what happens with this technology really starts to come to life. And that's what we're already starting to see. Now the question is, how does a retina selfie get into the hands of all the consumers that are out there that don't know about it? Is it possible that health plans start to prescribe apps and devices and technologies to their consumers rather than just benefits? Would you consider this a benefit? And how would you pay for something like this? Is there a scheme where employers like Motley Fool, I should work for them, great company, how would they start to prescribe something like this so that it gets into the hands of the employees that can start to take advantage of it? So think of all of these innovations and changes that are happening in the context of how does it actually get implemented into a practical way of using it for the end users that actually need to take advantage of it. Similarly with surgery, I got an article recently from Facebook that said, hey, we want to talk to you about healthcare. So Facebook had acquired a company called Oculus, which does virtual reality goggles. And I was a little puzzled. I thought maybe I'd posted something incorrectly on my Facebook page and I was being called to take it down or something. But turns out they want to do some pilots with Oculus Rift, which is, again, a company that was focused on creating a better gaming experience using sort of 3D imagery with their goggles. And so now they want to pilot it in the surgical environment. So it's really difficult, I would imagine, for medical students to be learning about surgery. But if the surgeon's actually wearing that and performing that, and that's being beamed to a set of classroom students that can see that information and that procedure being performed in real time in context of all of the analytics around it. Is the right procedure being performed? How is it being performed? What else could be done? So you're sort of learning about it in real time in a far more immersive environment with the benefit of having all of the data that comes along with it, so that you're putting the two and two together and you're really changing the way in which surgeries are being performed. So, and then there are examples across the rest of the value chain. So administration could be more effective. I would say that the least intelligent person, the least intelligent stakeholder in the entire ecosystem of healthcare is probably the consumer, me included. I spend more time probably thinking about where to eat and looking at Yelp and OpenTable and all the reviews. But when I have to go see a doctor, it'd be like, oh, go see my normal PCP, or I call my neighbor and say, hey, who do you see? And she recommends the best person they've known. And I go base my decision on that with no basis on information, no data on outcomes or price or quality or any of the things that are available, but are hard to go find because, quite honestly, finding a restaurant on Yelp is far easier than finding out, how a doctor is performing, right? So a lot more examples. And I won't kind of bore you with all of them, but the last one I think is particularly interesting. So if we hear a lot about the cost of healthcare, and this particular conference, one of the topics obviously is cost. And if you trace it back to where is the cost coming from, and we've done lots of surveys on this, the primary sort of driver of cost in the minds of people that are not in the insurance space seems to be, or people that are in the general ecosystem seems to be that insurance companies drive up cost. And that couldn't be further from the truth. What's actually happening is that there's a whole ecosystem of drugs, pharma, the other benefits in medical technology, and everything that's evolving that's driving the inflation in medical costs. So the question is, but there is no evidence that that inflation in that medical cost is actually having an impact on the quality or the outcomes of any healthcare metric that talks about quality. So what can we do to sort of make an impact on the quality of all of the medical technology out there that's escalating, and the rest of the ecosystem that needs to figure out how to bend that curve so that the cost just doesn't go out of whack. So the amount of money that we're spending on healthcare in the US is not sustainable. We all know that. But we're not unable to do it because the alignment of the stakeholders around these various silos just hasn't happened yet. So one solution to that would be, to at least make an incremental impact, would be how about we connect technologies that are far more cost effective directly into the hands of consumers. So there's an organization called CrowdMed. It's a group of physicians that are globally crowdsourced, where you can submit your case, and a doctor and a set of scientists look at that case and respond back with their diagnosis and information on what the best therapy is. And when we looked at a sample of 30,000 patients that have submitted that relative to a control group that basically looked at the same data, the outcomes of that crowdsourced function was far higher than all of the high quality care, high cost care that was sourced in the US. So there's lots of innovations like that are happening. The question is, how do we take that and grow it exponentially so that it's available to a much larger portion of the population than it is today? So we see a lot of hope. There's lots of challenges in terms of the barriers between how to get the data into the right, to the hands of the right consumers. But the way I see it, again, going back to the oil and the refineries question, I think if you recognize and treat that data as a precious asset and start measuring things like health data equity in terms of the amount of data and the effectiveness of that data, and the channels that get us out to all of the stakeholders that are out there, then we can have a set of metrics that we can track and then gradually start to align programs, policies, and all of that to the adoption and the growth of those. So I'll leave you with this. So we have things like Siri on your iPhones, equivalent named assistants on other phones. Amazon just came out with a digital assistant called Alexa. It tells you whether and can order an Uber and Domino's and whatnot. So there's this notion of back in the early, I would say in the mid-90s, the enterprises started moving to the web. Every company now has a .com or a .org and other websites. We've got mobile apps that now you can access, you get access to your bank accounts, your flights, traffic, and whatnot. What if there was a set of digital assistants we can start to create for health that start to connect the dots between socioeconomic factors, how you're feeling, all of the bio, sort of sensory data that we're starting to collect, and start to provide some real contextual advice on a day-to-day basis on what you could do, in terms of making better decisions. So this, I'll close with this, is a video that we put together as a thought piece on how this might come together, around how to connect the dots between the data that's available to us today, what we might be able to do with it, and how we sort of act on it on a day-to-day basis.
Data regarding an airplane's engine is constantly monitored and analyzed to provide insights and ensure that it's running smoothly. The same type of data is available about us, about our minds, our bodies, and our health. But we don't monitor, analyze, or connect it to make sure we're running smoothly. But what if we did? What if there was something that could collect your data and create personal health insights tailored specifically to you? What if it could come up with daily nutritional recommendations based on your own real-time personal health metrics? What if it could help you better understand and manage your individual care plan when you're sick? Or help you care for and manage your mother's care plan from across the country? What if, when you had a health issue, it could help you answer your most complicated questions based on the most up-to-date research and using real-time expert opinion? What if it could help you become smarter about your health by understanding the things that you don't know but should? What if it could tell you when something wasn't right, and not only tell your doctor about it, but schedule an appointment for you as well? What if it was able to give you information by connecting different things about your life that only you know should be connected? What if there was something that could do all of that? Meet Nora, powered by the Deloitte Cognitive Platform. Here's how it works. It starts by collecting all the relevant data you allow it access to, things like medical history, lifestyle, behavior, weather, and location, as well as personal preferences around food, exercise, hobbies, and more. Then it uses machine learning algorithms to find patterns and relationships between these disparate sources of information. Finally, it generates personalized insights about your health and makes them available to you in the context of your daily life through whatever channels are most convenient. An invisible force that appears when you need it, making healthcare personal for everyone.